The Wildwood family hopes a story about the death of a loved one to cancer will save others.
They spoke with Fox Files investigator Chris Hayes to raise attention about other health threats affected by the pandemic.
Joshua Hall was a miracle baby.
His original problem was a heart. He was born without a tricuspid valve in his heart.
After his birth in 1977, his parents were told he would not live long.
First we heard 5 years, then we heard 10 years. And then as things started improving and medications were improving, they were just saying, he's doing good.
Each year brought incredible family stories and opportunities for Josh to give back through his ministry and his mentoring. This past spring, now 43 years old, he knew something was wrong, but could not see a doctor in person because of the COVID shutdown. His sister, Julie Green, said he would not take no for an answer.
He lost over 35 pounds, and it wasn't until he took pictures of himself, basically stripped down to his boxers, and sent them to his doctors.
Josh's family said he got his appointment too late and died from cancer.
When they found the mass, it was 4 centimeters, which is not that big. It was 4 centimeters in his large intestine. And if they had found that 4 months earlier, if they had let him in when he was trying to get in.
Dr. Bob Farmer, who was recently a medical director for an Illinois hospital group, fears there could be hundreds of thousands of people like Josh.
While we focus so much on COVID, and we should, it's deadly and it's very problematic for especially the elderly and the people with comorbid conditions. We must also keep in mind at what expense and how does it balance with other health problems that Americans face.
Dr. Farmer points to recent cancer studies revealing a drastic drop in screenings and diagnoses.
Based on the data I've reviewed, those numbers are down 40%, which means between 700,000 and 800,000 people this year and probably going into this next year since COVID started are not being diagnosed. And it's not that the cancer is not there.
And mental health. A recent health alert from the World Health Organization highlighted its survey showing the COVID-19 pandemic has disrupted or halted critical mental health services in 93% of countries worldwide, while the demand for mental health is increasing.
And I fear that too many people are afraid to talk about it for fear of being vilified.
Dr. Farmer believes the solution is to constantly debate new ideas during this unprecedented time while maintaining an open mind and compassion, the same codes Joshua Hall lived by. For the Fox Files, I'm Chris Hayes.